LabTV. We are America's online video medical network, honoring doctors on the front lines of medicine, including hundreds from America's top hospitals and research universities, and hundreds more from the NIH.
Most important thing to me as a doctor is integrity.
I'm very much interested in improving the human condition.
At the heart and the center of everything is the patient.
LabTV, bringing you this video spotlight.
There's some women who have had their first pregnancy, they might have had a stillbirth, or they had multiple miscarriages. And to say, you know, I'm going to see you one day with that baby in your arm and then for that to happen is really the most rewarding experience for me. You know, it never gets less than that. It's just as exciting every time it happens because it's for that individual, it changes their life. My name is Joanne Stone, and I'm the Director of Maternal Fetal Medicine. So I think what sets our practice apart, number one, we restrict our practice to really high-risk patients for our own patients that we deliver. So we keep it small. It's really like a family feeling. After delivery, our medical assistants will go and visit our patients on the floor. When I have patient labor, my stenographers will say, "Who's in labor?" Because they know the patient. So it's really a place that everybody feels, the patients feel very taken care of, and it's a very warm environment. Really, the most important thing is healthy moms and healthy babies. For me, that's the most important thing. Keeping the mother healthy, keeping the baby healthy, that's the most important thing. And also practice medicine in a way that makes patients feel comfortable, that they are part of decision-making processes when they want to be, that they're really informed, that we answer every question possible for them, and just provide them with a level of comfort in their care. Sometimes the decision might be not continuing the pregnancy, and sometimes the decision might be, well, how can we best improve this outcome? If it's a patient that we diagnose with a fetal heart abnormality, getting the pediatric cardiologist involved, getting the neonatologist involved, getting genetics involved, working with all the other disciplines to optimize the situation for the patient. So sometimes it's not, the perfect outcome, but it's making the best, of a situation that's not optimal. One of the things that we do is do a lot of preconceptional consultations. So for example, a patient with a history of a seizure disorder or diabetes, they come in for a consultation and we sit with them and go over what their current health status is, what their glucose control is, what we need to beforehand optimize the situation to give them the best possible outcome. We can also offer some prenatal genetic screening tests. Mount Sinai has just come up with this amazing panel where we can screen couples for 281 different genetic disorders, and if they're both positive for the same one, we can do a test to see if the fetus is affected or not. So all these things, talking to patients before they actually get pregnant, can be a very important step.